Hi guys, welcome back to another video. Today's video is just an introduction to a new segment to this channel. It's going to be called Know the Diagnosis. Yes, Know the Diagnosis. In this segment, I'll be talking about some medical diagnoses, their basic symptoms, and ways to manage these diagnoses, as well as some tricky points and must know. So stay tuned. The first diagnosis for this segment is CHF, which is known as Congestive Heart Failure, popularly known as heart failure. So this is a condition whereby the heart is weakened and can't pump blood effectively to meet the body's demand, or it can't distribute the blood effectively to meet the body's demand. There are two types of heart failure: the left-sided heart failure and then the right-sided heart failure. We're going to talk about left-sided heart failure first. So let's think of the anatomy of the heart. You know, we get oxygenated blood from the lungs to the left atrium and then to the left ventricles. But then in this case, since there's a problem with the left side of the heart, the blood that comes to the left atrium will be forced to go back to the lungs, and it's just going to sit in there. And that gives us the respiratory symptoms of left-sided heart failure, which includes dyspnea, crackles, fatigue. Yeah, all these are symptoms associated with left-sided heart failure. Right-sided heart failure occurs when the right side of the heart is unable to pump blood effectively to the lungs for oxygenation. This forces the blood to travel through the pathway where it came from to sit in the rest of the body. So you know, it comes from the superior and inferior vena cava into the right atrium and then to the right ventricle. So in this case, it's going to travel back from the right ventricle to the right atrium and then to the inferior and superior vena cava, and it causes it to have symptoms such as jugular vein distension, ascites, edema, and even weight gain. Usually, patients with heart failure are advised to modify their lifestyle, which include actively exercising and then changing their diets. So patients are usually advised to reduce their sodium intake, as wherever sodium goes, water follows it. So patients are advised to reduce their sodium intake, thereby reducing their fluid intake, which helps manage the symptoms associated with heart failure. With diuretics, it helps excrete more fluid from the body, as we know that heart failure has a symptom of like fluid buildup, ascites, weight gain, edema. Taking diuretics help manage the symptoms associated with heart failure. So watch out for dehydration in CHF patients, as they may look fluid overloaded, but they may actually be intravascularly dehydrated. So watch out for that. Also, CHF patients are advised to weigh themselves regularly, as rapid weight gain is an indicator of fluid retention. So this general overview of congestive heart failure gives us an idea of what the disease is about, the symptoms associated with this disease, and certain ways to manage CHF. So this brings us to the end of today's video. Thank you so much for watching, and don't forget to share, like, comment, and subscribe. Until we meet in the next video, which is also going to be a diagnosis video. It's a peace.